Hi, everyone. Welcome to the CF 101 panel. My name is Lauren, and I'm a 26-year-old CF patient. I live in San Antonio, Texas, originally from Houston, and I live here with my husband and my two dogs. My CF journey started when I was about 2 months old, and in November of 2019, I started on Tricafta, which has been a complete game changer for me, for my health, for my family. So that's just a little bit about me. I'll be moderating our session this afternoon, and we will get to our intros for our lovely panelists in just a moment. But I did want to just let you know that this is a Q&A session. So on the right-hand side of your screen, you'll see a Q&A box. Go ahead and ask any questions that you may have in there. If you see a question asked that you would like to give a thumbs up to, showing your support for that question, go ahead and click that like button and it'll pop up on our screen, and we'll know that that's a hot topic that hopefully we can get to in our Q&A session. And you'll also notice on your right-hand screen, there is a chat icon. That's the event chat. You can speak with other participants in the panel session, and we will keep an eye out there. Our panelists, if you feel like chatting in there, you can as well. Don't feel obligated, just if you want to. And then another thing is that we have some resources specifically for this session. We'll probably bring up some terms or abbreviations that you might not be so familiar with, especially if you're new to the CF community. If you're an old hat, you again might say, I've never heard that one before. We do have some resources that we put together that include common medication names and types, and common abbreviations and terms. So you can click those links there in the chat and follow along with us. All right, and so we will start with introductions. Yvette? Oh, you're on mute.
Oh no, there we go. Hi everyone, I'm Yvette Imsand. I live in Georgia. I'm 30 and I am a CF spouse. My husband and I have been together for 12 years and married for 2. So I'm no stranger to the CF world. He was diagnosed at 6 months and is 38 now, and was diagnosed this month last year with CFRD. We have 2 dogs, and I started just kind of learning whenever we first met. He was very open about his CF and taught me a few things, and I decided I wanted to know more. So I started looking for answers, and it was really communities in the CF world that is where I got the most of my information from. So I'm excited to help pass some of that information along to you guys. That was so helpful to me.
Thanks, Yvette. We're happy to have you here. Drucy, would you go ahead?
Sure. I'm Drucy Borowitz. I'm the head of Community Partnerships, which is the department at the CF Foundation that sponsors events like FamilyCon. I don't have cystic fibrosis. I'm also a physician, and I was a CF Center director for about 25 years. My training is in pediatric gastroenterology, but I practiced as a pediatric pulmonologist, so I have a slightly different view of CF than someone who has a single specialty. I'll be 67 this year, and I'll be retiring at the end of the month, but that doesn't mean I'm leaving the CF family, and it really is a family. So for those of you who are new, welcome.
Thanks, Drucy, and congratulations on your retirement. Alex?
Hi everyone, my name's Alex Gantt. I'm 34 years old and I live in Colorado with my amazing husband and our 2 dogs. I was diagnosed with cystic fibrosis at 9 months old and spent most of my life not really talking about it to anybody. Because of this, many of my friends and family members don't really understand what all having CF entails, and at this point they're embarrassed to ask me. So you might be here today because you're newly diagnosed and don't know where to begin, or you're a parent who just found out your child has CF, or you're the aforementioned friend or family member who just really wants to find out more. Whatever brought you here, welcome. Please don't be shy about bringing your questions to us. I can almost guarantee you that someone else here has the same question, but doesn't want to be the one to ask.
Great. Thank you, Alex. So I wanted to start off with a quick little overview question of what is CF. I know it seems very basic, but I think for this session especially, it's important just to give a little bit of background. So CF is a genetic disease. It's caused by a mutation of the Cftr gene, and it causes thick, sticky mucus to build up in the lungs, digestive system, sinuses, and it can cause frequent infections that are typically antibiotics that are oral, IV, are needed to take care of those infections. In recent years, you've probably heard of these things called Cftr modulators. They basically correct the cell and then make it work properly. And so about 90% of the CF population is eligible for these modulators, but there is still that 10% that is not eligible, or the modulators just do not work for them. So with that being said, I do want to start off with our first question here. We have a question that says, what are PFTs? Alex, I want to throw that one to you.
So PFTs, pulmonary function tests, are breathing tests that measure your lung function / capacity. You may also hear them called spirometry or sometimes just spiro. To take the test, you take a full deep breath and blow it out for as hard and as long as you can. You generally do this test about 3 times, and whichever number is your highest score is typically the one recorded. Your breath out is then measured across several different categories. The main one that you hear about when people say PFTs is the FEV1, which measures the amount of air that you can blow out over 1 second. This percentage is usually the one that people are talking about when they tell you what their lung function is. There's also a little bit of difference between centers, so I am going to toss it to Drucy to explain that.
So lung function is based on how tall you are and what your age is. And so we talk about percent predicted. So what would we predict would be the, for example, FEV1, that number that Alex talked about, for somebody of your height and age. And there are different sets of predicted equations. So you don't always see that numbers are exactly the same. The ones that we use in the Cystic Fibrosis Foundation's registry are the Global Lung Initiative predicteds, GLI predicteds. So if that's not what they're using at your site for numbers, your percent predicted might be different. And then the one other thing I wanted to say is, like Alex said, you have to be able to take a really big breath in and really blow out and keep blowing. And so little kids can't do that. You really have to be able to follow directions. So most kids start trying to do lung function tests when they're around kindergarten age, maybe. But like babies don't do that kind of a lung function test. It's mostly kids who are school age, first grade and over, something like that. Back to you, Lauren.
All right, thank you guys. Our next question is, why does CF affect so many organs and systems? Drucy, I'm going to let you take that one.
Yeah, so Lauren mentioned CFTR, this thing that the CF gene makes, and it's like a little pore, almost like a pore in your skin. And skin protects us from the outside world. So any place in the body that the outside world comes in, like when you breathe in air, or when you eat food, or in your reproductive tract, is lined with the equivalent of skin. And so that CFTR channel isn't working in all of those places. And we've learned a lot about when you use these drugs like Kalydeco or other really effective drugs like Tricafta, and you switch on CFTR, it affects your entire body because that CFTR is in the whole body. There are also some endocrine parts that are affected, and I'm going to let Yvette talk a little bit about what she mentioned before, CF-related diabetes.
Yes, so part of one of the complications of CF can be that you develop CFRD, or cystic fibrosis related diabetes. Not everyone will develop CFRD, but it is somewhat common in the CF community. It's kind of its own beast, and really comes from the body's inability to really keep up because of that mucus buildup that was talked about. It can affect how your organ systems work. And so in this case, it affects how the pancreas works. When it stops working as well, it stops producing insulin as well and delivering it to the body. And that can cause some patients to require insulin as part of their treatment plan.
And Yvette, you mentioned before, that's not everyone, right? So
no, that's not everyone.
People get older and we watch for it, but not everybody with CF develops CF-related diabetes.
No, not at all. And that's why it's so important to just keep up with your labs. My husband was diagnosed a year ago with it after just routine testing with a test called OGTT, which is an oral glucose tolerance test. Somewhat of a time-consuming test, but his previous labs had showed that, you know, he was kind of borderline and they were watching for it. They were concerned and decided to do that test. And that confirmed that he was having an insulin issue and did need to be treated for it. But he lived to 37 before that ever became a thing. So not everyone gets it. Different people get it at different ages. CF is really a unique beast. Everyone experiences it differently.
Yeah, CFRD is one of those things. I think there's probably a lot of room for research in that as we go forward. So I'm excited to see where that goes with the CF Foundation and other companies doing more research on CFRD. All right, so our next question
about the GI tract. Sorry, Lauren. I think Alex was going to say a little. Were you going to do that one? Okay, well, we're live.
Sorry about that.
Yeah. Before we move on, Alex, did you want to talk a little bit about how it's affected your GI?
Sure. So I am one of the lucky people that have the digestion portion of cystic fibrosis as well. That was actually how I got diagnosed as a kid, because I was diagnosed as failure to thrive. So actually, when I was growing up, the digestion part was the worst part for me. I was really, really skinny. I couldn't gain any weight. And I would have to run to the bathroom like 5 minutes after eating. I actually remember my parents having to go tell all of my teachers in elementary school, if she raises her hand and says she has to go to the bathroom, you better let her go to the bathroom. Like, none of this, you don't have a pass kind of nonsense, you let her go. So I've had to take enzymes my entire life. When I was little, I couldn't swallow them. I used to open them up and pour the capsules inside of applesauce and eat them that way. And so it was not until I was a teenager that the lungs really started to affect me. So the digestion was definitely the worst part for me when I was a kid.
Yeah, Alex, I remember having to carry around enzymes everywhere. I mean, I still do. But, you know, I was probably the only 5-year-old carrying around pills. You know, and a lot of kids would ask, what's that? You know, and I think in the story hour on Thursday, there was a story about, you know, having people ask what pills are and, oh, do you want to take some? I still haven't found out what would happen if a normal person took them. I don't think anyone's ever actually taken me up on that. But I remember bringing those pills around for sure. Sorry to cut you off there, Alex. But the next question I want to get to is, why do people with CF have to stay 6 feet apart? And Yvette, I think I'm going to let you start us off.
Absolutely. So the 6-foot rule is somewhat of a newer rule in the CF world. We didn't know as much previously as we know now. And it's really for infection control. So everyone has recently learned a lot about this, but it's very important for CF patients to stay 6 feet apart. They are the original makers of the social distancing rule and mask wearing. And it's because that thick, sticky mucus that lives inside their lungs is a perfect place for bacteria to live. It's very common to culture bacteria when doing sputum culture tests. And that bacteria won't affect a healthy person. I can be next to my husband while he has a lung infection, and I am totally safe and fine. But because that environment is so prime for bacteria in a CF patient, if they stand next to him, they could get some of the bacteria that he has in his lungs and then be infected as well. Two of the most common ones are Pseudomonas and B. cepacia. Those two are the ones we really look out for. They're very contagious amongst CF patients, but it's important to know they're really not contagious to healthy, normal people. It's just for the CF patients.
Thanks, Yvette. And Alex, I wanted to hear from you. You had an interesting story about the whole social distancing and what that looked like when you were growing up.
Right. So as Yvette said, it is a fairly new rule in the CF world, about 6 feet apart. When I was a teenager in the hospital, they actually had a conference room set up for CF patients to hang out together because they didn't want us to go into the normal rooms where other people were. And my parents never let me go hang out with the other CFers, not because they thought that I was contagious with them. They just didn't want me to go anywhere in the hospital. So I guess that's a good thing because I never got, too close with anybody. But at the same time, that was probably the one and only time in my life I could have been physically with other CF patients. So it's kind of like a catch-22. There was also another girl who had cystic fibrosis in my middle and high school. And we were in a lot of the same classes. We even sat right next to each other in a lot of classes because we just had no idea. And I was 18 the first time they told me in the hospital, by the way, you can't be around CF people anymore. and then they basically quarantine you to your room for 2 weeks. And that was a really new experience for me. And I remember, Lauren, you said you have some stories about people that you went to school with, so I'd like to hear about that.
Yeah, so Alex, it's kind of funny. I had a completely different experience. So I went to high school and junior high maybe, I don't know, 10, 15 years ago, if you want to calculate beginning and end. And so I would always be told if there's another CF patient in the school. So it turns out when I was a sophomore, there was a freshman who was a CF patient. That was the first instance that there was another patient in the school. And so we had to coordinate our classes, make sure we weren't in the same building as each other, make sure our lunch periods were not the same. So whenever we went to go get our meds from the nurse, we would, were separate, and that the nurse would have enough time to wipe down things and, really just go ham on the whole infection thing back when Lysol wasn't a hot commodity. So it was a completely different experience. A lot of my relationships with CF patients have been virtual, and that's why these virtual events are so important in the CF community. We were figuring out Zoom and Blue Jeans years before everyone else was, so I feel like we have a leg up there as well. But it was just a completely different experience. In the hospital, we would be on different sides of the floor, sometimes on different floors, depending on if someone's growing B. cepacia or something else. So it's interesting to hear about your experience, Alex. What was that CF camp, Yvette, that you were talking about?
Oh, yeah. My husband actually went to a camp called Camp Whack and Hack here in Georgia growing up as a kid. And it was specifically for cystic fibrosis patients only. They had doctors and nurses that were all from local CF centers in Georgia, and I think from a couple surrounding states. And so that was kind of a shock for him to go every year and have the environment of just being surrounded by people who truly get what you go through every day, where it's not abnormal for everybody to be sitting around and doing hours of treatments every day and vests and things like that. And everything was geared towards their abilities with their lungs and things like that as well, to suddenly not being able to be around anyone. And that was before social media was really a thing either. So it was hard to keep track with anyone from the camp, and it was hard to continue to be involved in the CF community at that time because the whole game had been changed, really.
Yeah, I will never forget the name of that camp. That is just perfect. But Drucy, that does bring up another question about siblings with CF, a family with multiple people with CF, how that social distancing, how that 6-foot rule looks. Can you tell us more about that?
Yeah, I think we all have this experience with COVID-19 that we're trying to kind of find a way to be have a reasonable approach, but also be safe. So when there are 2 kids with CF in the same family, or maybe more than 2, you're not going to keep them separate, right? They're siblings. But then you want to do the reasonable things, like we learned from the experience of Camp Whack-and-Hack, as you said, Lauren, a name I'll never forget. But like 2 kids with CF who are siblings shouldn't do chest PT in the same room at the same time with each other. Shouldn't share cups, shouldn't share toothbrushes. I mean, not that anybody does, but just things that are reasonable in that way. But you're not going to keep 2 siblings apart. And in fact, these infections can be transmitted from one person with CF to the other, but it's not like it always happens, because you can often see 2 siblings in the same family that are growing different things in their lungs. So just finding that middle ground, not being too crazy, but being safe. So that's what I have to say about siblings.
And I don't have any siblings with CF, so I can't really say on a personal note. And Alex, I think you're kind of in my boat as well, that you don't have any close family members. But Drucy, I do appreciate you giving us a little more insight into how that looks in the family dynamic. So I want to get to this next question. If you guys have ever been to a CF clinic appointment, you guys obviously have. Drucy, you've been on the other side of it. You know that they could be very long, and I like to call it the clinic parade. You have people come through, and sometimes they just drop by and say hi and then move on. But there's quite a few people on that team, and maybe you'll see them every clinic appointment, maybe you won't. But just for those that are new to the CF world, I want to just quickly go through our CF teams, kind of who they are, what roles they play, and kind of your personal experience of how that works for your team. Sorry, Yvette, I was going to pass it over to you.
Oh, sure, absolutely. So when I first met my husband, we actually got really close really fast. We were living together within 3 months because we're crazy apparently. It was a good year or 2 before he let me start going to the appointments. And I struggled to find out what was going on in these appointments. Why was he gone for almost the whole day when he would have to go down there when it's only an hour drive from our home and things like that. And once he got comfortable enough for me to come with him to his appointments, I saw why. There are a lot of people that come in to see him. Every clinic does it differently. Some clinics you don't see everybody every appointment, others you do. And it may depend on the patient as well, but for him, in his clinic, he sees a whole host of people pretty much every time he goes in. So he starts off with the nurse. She'll just check in, take vitals, things like that. And then usually the respiratory therapist comes in next. That's who does his PFT tests and checks in on how all of his equipment is working. Does he need any new equipment? How often is he doing all of his different inhaled medications and things like that? And then next he usually sees his doctor, his pulmonologist. Now, if this visit we are also having some concerns with his diabetes, then the endocrinologist often will come in right after the pulmonologist. After that, we usually see, in no particular order, the nutritionist. Nutrition's a huge part of CF, making sure you maintain your weight, stay healthy, taking the right vitamins so that your body can thrive and things like that. And she also helps us with great snack options and things like that to help manage the diabetes. And then we also get visited by the social worker about every other visit, just checking in on him, but also she checks in on me. She wants to know how I'm doing handling his CF and things like that. They really support the whole at-home care team, which is fantastic and has been really helpful, especially when he's in the hospital and I can't be there She helps communicate with everything. And then we choose to participate in research. So research will come in and ask for various bodily fluids from him. Sometimes it's sputum, sometimes it's something else. But it just helps, it helps them understand how patients respond to different treatments and can help create new treatments. So that's something we choose to do, but it's by no means required, and not all centers have a research team that close by. This one's across the street. So it just really varies on where you are and kind of how your clinic does things.
Alex, did you want to give us a little bit of your experience as a patient?
Sure. So as Yvette said, clinics are usually very long. Mine typically are about 5 hours. I am alone in a room for most of that 5 hours, though. It's a lot of just sitting and waiting. I always make sure I have a book with me. But it also does depend on which clinic you go to, on who all you're going to see that day. So I always see the nurse, I always see the doctor, and those are the only two I can guarantee. Sometimes I see the social worker, sometimes I see the dietitian, sometimes the RT, sometimes research. A lot of times people will just pop in as well, just to introduce themselves, and you'll probably never see them again. But the main thing about clinics is just how very, very long they are. And I remember when I used to still work, and I had to tell my boss that I had to leave at noon to go to a doctor's appointment. And the first time she said, "Are you coming back?" I just laughed, because I sure wish that I would be done in time to come back, but that would never happen. It'd be 6 o'clock before I'm heading home at that point. So.
I definitely.
Drucy, did you have anything? Oh, sorry, go ahead, Lauren. Sorry.
I was like, I can attest to that. I think I definitely have to schedule it in advance, a few weeks in advance, and tell my boss, look, be out for the afternoon, and do the out of office email response, because it does take quite a long time. I do remember in the pediatrics, I did see every team member every time, but now in adult, it's every now and again. Maybe I'll see the dietitian or the social worker if there's something that I need to talk to them about. Most recently, I've learned the social worker isn't just for like you said, Yvette, like how are things going at home? Like, are y'all okay? Your emotional, mental well-being, but they're also a great resource for anything with insurance. I recently changed insurance this year. I turned 26, so that's been a headache. But my social worker has been great at providing help. I can email her if I ever have any issues. So I think as you get into being an adult, and maybe even parents with kids, like just knowing that, the team, it's a multifaceted team. Like if you have a problem or a question, there's gonna be somebody on your team to be able to help you out, or they may know somebody that they can reach out to. So your team isn't just like they come by and say hello or take your blood or, other fluids, Yvette, but they are there as a great resource. Drucy, did you want to talk about how, like I said, like with the pediatrics, why typically you see every team member each appointment compared to adults?
Yeah, I mentioned before that young children can't do PFTs, spirometry, that lung function test. And so growth is a really important measure of just general health. And so in that first year of life, there are a lot more visits. And even after that, pretty much the dietitian will see you just about every single visit, unless you happen to be one of the, small percent of people who have a working pancreas and don't need to take enzymes and don't have a growth problem. But especially in little kids, that early growth is really, really important.
Great. Well, I did want to get to a couple of our questions that came in while we were going through our little question group here. And again, I want to just reiterate, you guys can continue to ask questions as we're answering these. We love answering questions from you guys, getting to know what you want to know, at least from our perspective, how we can help you. There is a question here. I'm gonna bring it down a little bit. Is it okay to walk around pond water? So like this, I guess they're saying they understand CF patients should not or cannot go in pond water. So they're asking, is it okay to walk around it? And just confirming, like, is going into pond water something that's allowed or something that CF patients should or should not do? I feel like, Drucy, that might be a little more in your ballpark. Feel free to bounce it around if you feel like that's not necessarily true.
Sure. I think this gets back to what I was saying before about being reasonable. So these germs don't like jump out and attack you. They're really, you can walk near a pond. It's wonderful. It's good for your mental health. I'm a grandma too. I love to walk near water with grandchildren. I mean, you just want to enjoy life as well. And, many of these germs that we've been talking about are there. They really are everywhere. So you're just trying to find that reasonable way to find a middling ground. But walking near a pond is good for your mental health, which is good for your physical health.
Did any of you two have anything to add to that?
I'll be completely honest. I just learned about the hot tub and pond and lake rule. I didn't even know. No one had ever told me. So I'm completely new to the information and am still learning myself. So it was actually news to me.
Hey, Lauren, I'll add that on cff.org, that's the Cystic Fibrosis Foundation's website, you can see a summary of those infection control, infection protection and control guidelines. They're all right there, cff.org. Sometimes it's hard to find things on the website, and honestly, if you go to Google and you put in what you want and you write Cystic Fibrosis Foundation, it'll put you right on the website. Yvette, you were going to say something.
Yeah, so kind of piggybacking on Alex, I actually didn't really know about these rules either until I think it was 2 years ago. We actually went to somewhat of an after party to celebrate the success of another CF event that I'm involved in, and someone had their dog there. It was in someone's backyard. And he brought his dog, and his dog was blind and actually fell into a pool that hadn't been shocked yet for the year and was drowning. And my husband, being the dog lover he is, actually jumped into that pool and contracted a bacteria that had him pretty sick for a while. And before that, I really didn't know of the rule. There's a very clean, small little lake we visit every summer that he spent his entire life swimming in. Every single summer, his grandparents owned a property there, so I never knew of the rule. I'd always seen him in that particular body of water, and it wasn't until he ended up in the hospital with this infection and they told us about the rule that I came to know about it and had to start doing research and learned how dangerous it can be if you're not careful.
Yeah, it's definitely something that, again, like we like to reiterate on these panels, is that these are all your personal experiences and your personal perspectives. Of course, there is, the biological side of it and the medical side that we need to be mindful of, but definitely it is your decision as far as, what risks that you would necessarily take. But definitely thank you guys for sharing your perspective and your experience with that. Another question is, what does the future of CF look like in terms of advancement and the community? So maybe more so, what are you, for this panel at least, what is something that you would like to see as far as like an advancement in the CF community itself?
I'll jump on this one. We've had so many advancements in the last several years. Research has really done a beautiful job of trying to create different medications, which we call modulators. And they, in layman's terms, they basically help the CFTR protein work more how it was originally intended to. But because there are so many different mutations and combinations of mutations among CF patients, there's not really a treatment for everyone yet. We've hit about 90% with Tricafta, but there's still 10% of patients that don't qualify because of their mutation. There's also patients that don't qualify because of biological reasons. Their body may not be able to handle the medication. They may be too young, different things like that. They may have already had transplant. So I think it would be amazing to see what research comes up with in the coming years to really address the patients that don't have anything yet, while also working towards that cure and other treatments that can just make life easier for patients with CF.
Alex, do you want to add anything?
So I am definitely one of the lucky ones that is eligible for Tricafta, and it has been life-changing for me. And so I'm going to kind of piggyback what Yvette said, though. There is still 10% of the population that can't take it for, you know, all the reasons she said, and also for people that live in different countries. There's countries that haven't approved it yet. So I want to reiterate, you know, that it is not a cure, first of all, because that was the first thing that everyone thought. It's great. It's done great things for me, but it's not a cure. I still have CF. And there's still a good 10% of people who don't have this. And so my hope for the future is that eventually there will be something that everyone has. And one of my favorite quotes that I see on social media all the time is, "Let's keep going until CF stands for cure found." And I always think about that.
Yeah, I want to jump into, I think this is an amazing time in the world of CF. Like, there's no question that when you hear about this diagnosis, it just hits you like a ton of bricks. And like everything else, you know, there's ups and downs. But what we've seen with Kalydeco, which was the very first one of these really powerful drugs that just turns on the CFTR, that's now been pushed down in age. So when we study medicines, we usually study them in older people first, and then push the age down. And so now babies as young as 6 months can be on Kalydeco. And we've seen some amazing things. And what we hope for the future of people who start on those medicines at a young age is that their CF will really be different, although we're all going to learn about this as we go along, right? Tricafta, the medicine that Lauren mentioned, we are actively in the process of pushing the age down. So it's approved for people who are 12 years old and older. We remain optimistic, although nobody can promise that it will be approved down to age 6. Research is being done to push that age even younger and younger, and I think that will happen faster than for Tricafta, than for Kalydeco, rather. And then the other thing is just talking about this 10%. I think there is amazing research going on, and it may not be here right at this moment, but one of the amazing things about the CF community is we are all in this together. And, you know, we're not going to leave anyone behind. And the CF Foundation is absolutely 100% dedicated to that. And the last thing I'll say is, you know, the population of adults is growing and growing and growing, and is going to get bigger and bigger. And so even if we can shift the course of the disease, there still are a lot of different ways that CF affects the body. And so we have not left that behind. We've talked about infections. There's a lot of research into very different ways of treating infection, of helping people who have more severe lung disease, of looking at CF-related diabetes, or a whole raft of other things. So I think it's an amazing time. And, you know, as Yvette said, I mean, for the people who have contributed in research, like, we can't do this unless people with CF are willing to help. So my message I leave you with is this is an incredible time of success and also hope.
Thank you for sharing that, Drucy. A quick question that we just received was, at what age can CF patients begin taking Tricafta? I believe currently is it 12 and older? Is that correct? Okay, perfect. So like you guys said, I mean, I was talking to my doctor about this just this week during my telehealth appointment. It's just how incredible it is that these kids can start taking these modulators so quickly, and how that's going to completely change the makeup of the CF community. I feel like in the next 10, 20 years, we're going to see so many more adults living with it and being able to live a normal life because of these modulators. And like you said, Drucy, then we can start talking about geriatric care, things that never we would have never even thought to look at in the CF community. And I do just want to give a little plug. There is every fall, there's a national CF conference. Typically it's live streamed. I don't imagine it's going to be different this year. That they talk about a lot of different upcoming research projects that are going on. So I encourage you guys to keep a lookout for an email. I'm sure you'll hear from the CF Foundation about that. But it's a great way to just kind of get your pulse on what's going on in the CF community if you're interested in learning more about that. I did want to just do a couple more questions. We're kind of getting near the end here. Alex, I want to ask you, because you're on Tricafta as well, what has your experience been like? You said it's life-changing. Can you talk a little more about that?
The biggest thing that comes to mind is how quiet I am now, because I don't cough as much anymore. It was just such a part of my life, coughing like that after starting within a couple weeks, not hearing myself anymore, not waking up in the middle of the night. I used to wake up coughing all the time and wake myself up. And I will talk to my niece and nephew on FaceTime for an hour, and they even notice, like, you don't cough anymore. They were used to me having to stop and having these coughing attacks all the time. And it's been really crazy in a good way. It's also a little odd because I feel like I don't know my own body anymore, because I always, I lived for 34 years and I was like, this is how I feel when I'm getting sick, and to not know anymore, it's kind of strange. I did also have some pretty brutal side effects with Tricafta. I know some people have side effects, not everyone does. I am one of those people that if there's a side effect for a med, I'm probably going to have it. I had really bad, like, debilitating headaches. I had dizzy spells that lasted for hours every single day. And it took about 75 days before I had my first day with no symptoms, or no side effects, excuse me. It was still worth it because of how well I could breathe. I can take in a breath, not coughing. It was worth it to me, and I'm glad I stuck it out because now I'm on day 150. So only half of the time, was I miserable. So, but it's been life-changing. I would say just the weirdest part is not knowing my own body anymore. That's something I'm still trying to figure out, since I have only been on it for 150 days. So.
Yeah,
In that.
my husband is on Tricafta as well. Don't know the day count, but he started in the end of November. And his experience with all the modulators so far, this is his third one. He has been on Orkambi, Symdeko, which I believe is called Symkevi in some other countries, and now Tricafta. And he's had just different reactions to all of them compared to, like, kind of the bulk of the population. Everyone's CF is different, so they respond to these treatments differently. And because he has really low lung function, I believe they test these medications in the trials at 40% and above. Drucy, correct me if I'm wrong. And he's far below that line. So he didn't have, like, these amazing increases in lung function or anything like that. That's some of the stories that I've heard. But it was the same thing with the coughing as you've experienced, Alex. He coughs so much less. It's less disruptive to his sleep, less disruptive on the phone and things like that. Like, honestly, I almost never hear him cough anymore. And it's kind of an amazing thing, because he used to cough so much before all this. But another really weird thing happened. Um, about a week or two after starting Tricafta, he suddenly started having major blood sugar issues where he just kept falling way too low regularly, like every time he took his fast-acting insulin. And after talking with his care team, we realized that possibly because he was so newly diagnosed, the Tricafta was helping his pancreas to an extent, and he was able to reduce the amount of insulin he was taking. By at this point, he's about half the number of units as where he started a year ago, and the only change was Tricafta. So while his lungs didn't necessarily get the big improvement, other than purging out all that mucus and not coughing as much anymore, it did help another symptom he had from CF. It helped his CFRD. So it's really interesting to see just how it affects everyone differently, especially the people that were sicker than the trial patients. And I'm kind of excited to see what they come out with next.
Oh, for sure. I mean, I'm on Tricafta as well, and I was just asking my doctor about like what's next. Like we have Tricafta, and I know we have the next 10%, but like, are we done until there's a cure? Like, what's going on here? She said, absolutely not. She said we're already starting trials for another reiteration. I would call this Orkambi version 4. I call them like Orkambi version 1 was Orkambi version 2 Symdeco, but that's just me. Again, I don't know if we have that in that resource page. We should, but that's what I call it. But Tricafta has been, like I said, incredible. It increased my lung function by 20% within 3 months, which was not expected. I started out at 100% right before Tricafta. I did my PFTs, and then within 3 months I was 120%, which is, I didn't even know what to think for like a week. I was like, is this even possible? But Yvette, I do like that you mentioned that even though your husband didn't have the lung function increase, he did have that pancreatic sufficiency kind of more so come back. And so that'll be interesting to see how it impacts patients that maybe you don't see lung function, but you see pancreas. So that's really, really exciting.
Yeah, it did come up a smidgen with Symdeco, but it took about a year and a half being on Symdeco to really realize that he was slowly coming up like 1% at a time each, every 3 or 4 months. But his function is below 20%. So we didn't expect massive increases, but we were hopeful for maybe a little bit more. But since he's only been on it since November, we stick it out. We continue with it because you don't know what long-term changes you might see from them. So it's important to remember that just because you don't get instant results like some people, it doesn't mean you won't get results. Your body just may take longer to get there.
Yeah, Yvette, that's a great point. One of the things that we are learning as we're going along, like we're all learning this together, is it does seem as if there are some things, you can't just flip a switch and everything shifts. For example, when inflammation is there, it may take a while for that to get damped down. And then, Lauren, you mentioned, I think it was you, that one of the things I really want to say is that the CF Foundation is absolutely supporting the development of other modulators because not everybody has the same response to a drug. Some people have side effects where they can't take a drug. So this is, it proves we're on the right path. Like we really have found a way to shift the course of this disease, but it's absolutely not the end. Like this is just the beginning.
Thank you, guys. I did see a question asked, where do I find the resource page? So it's a couple places. It is in the chat, if the CFS staff wouldn't mind just posting it one more time. And it also is if you go back to the coffee shop environment, on the bottom panel, there's a little resource button. You click that and it's within that in there. And I think we may have it pop up here in the chat, but there's a couple of resources. There's the common medications that we've come up with, and then the list of terminology and abbreviations. So just one last little question before we, well, maybe a couple more questions. I wanted to ask you guys, what is the craziest abbreviation or term that you have come up with that wasn't necessarily a well-known term in the CF community, but you came up with it? Yvette, you're smiling. I feel like you've got something.
No, you're putting us on the spot here. I'm having trouble thinking of like something I haven't heard anybody else say that maybe would be a weird. I mean, he has nicknames for every single medication, but I feel like that's pretty normal. Everyone calls things different. We call Zopinex Zopi and Pulmozyme Pulmi, and Toby kind of coined its own phrase with branding. But I'm having trouble thinking of one.
Alex, did you have any? No?
I don't think I have one. I mean, I recently found out that not everyone calls tune-ups tune-ups. But there are a lot of people that do, so that's not me alone. But it was surprising because I thought that was what everyone called them. And I found out some people call them clean-outs. Some people just call them exacerbations. And so I didn't know until recently that tune-ups wasn't necessarily a common term all through the country. That's the closest one I have.
Yeah, and Alex, just for people who are new to CF, when you say tune-up or clean-out, what you mean is one of these moments where whatever that balance is in your body that kind of keeps things okay most of the time gets out of whack, and you're coughing more and you have more mucus, and if you can't respond to oral antibiotics and increased airway clearance, sometimes people get admitted to the hospital. So treatment, in-hospital treatment for a pulmonary exacerbation, like this worsening of cough and mucus, is sometimes called a clean out or sometimes called a tune-up. Hey, Lauren, something you asked the question, but did you have weird or
well, for me, it's Orkambi 2.0 or Orkambi 3.0 or Orkambi 4.0. Eventually, I'll probably get like to the point where I'm like, I'm just gonna call it what it is. Once the number maybe gets a little too high, but for me, that's what I call it because it's like it's this next group. But I guess for people who started off with Kalydeco, then it's well, I guess I don't know, but it's just for me. It's my thing, and people know when I say Orkambi 2.0, I'm talking about Symdeco or Symdeco. I still haven't figured out how to pronounce that one. I'm sure you guys are trying to figure it out too.
Like Kalydeco, Symdeco. So
that's what I thought, you know. Then the pharmacist says Symdeco, and I'm like, I don't even know anymore. Maybe they're right. I don't know.
We didn't come up with this one, but I do have a friend whose spouse has CF. They live in another state, and every time he goes in for a tune-up, he always posts online. He'll type into Facebook, well, looks like I'm headed for another week-long stay at the penthouse suite at Club Med, you know, just to make it like more fun in a sucky situation, really.
And I guess the other thing I'd say to people who are new is that not everybody ends up in the hospital being treated for pulmonary exacerbation. I mean, there are plenty of young adults who've never been in the hospital for treatment. And I think we've got so many preventive treatments now that were never there before. Like there's nothing wrong with being admitted to the hospital. Like if you need that, it's what makes all the difference in the world. Like being, doctors call it aggressive, like getting in there really fast and treating things when they're not right. So if you have to go to the hospital, just, you know, it's okay. It's really okay. But it doesn't necessarily mean that everyone gets admitted to the hospital for treatment. And we do have some inhaled antibiotics or oral antibiotics that sometimes are used that can prevent a hospitalization some of the time.
I'm glad you brought it.
Oh, sorry. Go ahead.
Go ahead.
I was just going to say, I also wanted to mention with IVs, so I very, very rarely go to the hospital. I actually do all my tune-ups at home. So there is, depending on if your doctor's okay with that, there is always the option as well. Even if you need IVs, you can be at home for them. So you don't always have to be admitted, but that does depend on a lot of factors.
But like babies, yeah, we mostly
probably not so much babies. Yeah.
Yeah, I'm glad that point was brought up, because a lot of people they'll ask what my husband's lung function is, and we're not usually too shy about it. But they hear that his function's in the teens typically, and they're like, "Oh my gosh, he must be in the hospital all the time." But he's really not. It's been a steady decline. He didn't go into the hospital a lot as a kid growing up. He did pretty well. It wasn't until high school he started having to go in anywhere from 1 to 3 times a year. And he was active at the time, playing football and things like that, because he hadn't had those big infections that cause all the damage. And then that slowed down. He did not actually have a hospitalization for 16 years straight, other than a little bowel obstruction we had I'd say about 8 to 10 years ago now. He had that, and then 2 years later was the first time he was in the hospital, and it was for the flu. And he didn't present normally, so we had no clue he had the flu until the test came back. Like, he didn't have any of those symptoms, just his lungs didn't feel so great. And sometimes, you need that break that forces you to stop working, stop dealing with the house, and just, go ahead and go in and let the doctors and the nurses do their thing that makes you healthier in the end. But to Alex's point, he does, now that he's been in the hospital more times, he does do a lot of his treatments at home. He does not have a port, so they do make him go to the hospital to get his PICC line. But depending on how he's doing and how his labs look, they will let him delay admittance. So what we do is we wait those 6 or 7 days that it takes for your culture results to come back, and he'll take oral antibiotics in that time. And then he goes in just for 2 to 3 days to get the PICC line placed, make sure everything's working correctly, everything's set up for home IVs, because it isn't as simple as going to the pharmacy and picking them up. It does not work that way. And you still have nurse visits and things like that when you're at home. But it is so nice that he's able to work with his care team in that way and find out exactly which antibiotics he needs to be on, but waiting at home to find out instead of waiting in the hospital when he's able to.
Hey, Lauren, can I add one thing? I saw in the chat somebody said SOB, like the abbreviation SOB, which is not what you think they mean. Like, to a doctor, SOB means shortness of breath. So nobody's trying to be mean to you if you see a note that says the patient has SOB.
And if you ever have questions, definitely ask your provider to clarify. Because again, like, the physicians use different terminology, I'm sure, that patients we may not even be aware of. So I wanted to just go ahead and wrap things up. I know we could probably talk for hours. We honestly have. So I would love to just thank you guys for speaking on this panel and giving us some information, some great insight. If anyone watching does have any additional questions for any of us, you can find our information in the participant directory. Again, go back to that coffee house environment. On the bottom, there is a section to find the participant directory and the resources that we spoke about. Again, just thank you guys for offering your time and your expertise on CF. And I just want to let you guys know that we do have about a 15-minute break between the end of this panel and our next breakout. Look at your personal agenda that was emailed to you to find out which breakout session you're going into. But again, just thank you guys, and I appreciate your help with this panel.
Thanks, Lauren.
Thank you, Lauren.
Thanks, Alex. Thanks, Yvette.
Thank you, everyone.